In this video, we'll talk about anxiety disorders. Let's start out with panic disorder. So patients will present with chest pain, palpitations, shortness of breath, dizziness, feeling like their life is ending or like they don't have any control. When they do present, you want to rule out any medical causes. So for example, like thyroid storm, heart attack, PE, for example, as well. Once you rule out medical causes, you can see if they meet DSM criteria for a panic disorder, which is recurrent, unexpected panic attacks without an identifiable trigger. And the hallmark of it specifically is more than a month of worrying that another panic attack is going to occur. Treatment for this is CBT and SSRI. You can give a benzo if you just need to get them out of the panic attack right now though, but for long-term CBT and SSRI are the best. Patients can also have depersonalization and derealization while having a panic attack as well. Next we have PTSD. So this can happen after a patient endures any type of trauma. They'll have intrusive symptoms like flashbacks, nightmares. They'll avoid places and people that remind them of the trauma. They can have increased arousal, hypervigilance, sleep disturbances. So treatment for this is trauma-based CBT and SSRIs. For the nightmare specifically, you can give someone Prazosin, which is an alpha blocker. Now, PTSD, they have to have these symptoms going on for more than a month. If the symptoms are there for more than 3 days, but less than a month, then it's classified as acute stress disorder. So it's the same type of symptoms, they just don't meet the criteria of having the symptoms more than a month. So everyone experiences stress. If someone is having a normal stress response to something that they experience, that means they're not having any impairments in their social or work life. So next, let's talk about phobias. Everyone's afraid of something, but if you have a specific phobia, then the DSM definition is you're having these symptoms for at least 6 months and you're specifically afraid of a certain object or situation. So for example, agoraphobia is a fear of being in public spaces. You can treat specific phobias with CBT or SSRI, especially exposure-based CBT. So if you're afraid of spiders, for example, right, you expose someone to spiders. Or you can also do flooding, which let's say you put them in a room full of spiders, that's flooding, as opposed to just like having one spider near them. So you can have social phobia. For this, again, you do CBT and SSRI. If they have performance anxiety, for example, they just have anxiety or a fear of speaking in front of big crowds, and let's say that's a big part of their job, you can give them propranolol, so a beta blocker, to take right before giving that big speech. Separation anxiety occurs at any age. I know most questions ask you when kids are really small, but it can happen at any age. And patients will present with somatic symptoms to avoid like going to school or going to work. So they'll be perfectly fine, but when it comes time to go to school, for example, they'll have stomach aches and they'll be like, oh, I can't go because I'm sick. For this, you do CBT for treatment. Generalized anxiety disorder. So patients with this, they worry about everything. They'll be at work, but their mind will be racing with thoughts about their finances, what they're going to cook for dinner, how their kids are doing, how their significant other is doing, maybe about what they said to a coworker earlier that day. Their mind is just worried about so many different things at once. And symptoms have to be there for at least 6 months. These patients also will be restless, they'll be very fatigued, they'll have issues concentrating, they can be irritable, muscle tension, sleeping issues. These are all other symptoms as well. So you can treat GAD with CBT, of course, SSRIs. You can also use Buspirone. And it's important to remember the difference between Buspirone and Bupropion because they can look alike and it's really easy to accidentally click the wrong one on the test. So Bupropion is a norepinephrine dopamine reuptake inhibitor that you can use to treat depression. It's the one that doesn't cause sexual side effects and helps people with smoking cessation, but it's the one you want to avoid in people that are more prone to seizures or have eating disorders, for example. So GAD, you can give Buspirone. OCD, you have to have intrusive thoughts and then the compulsive actions to get rid of them. And by DSM criteria, this has to at least consume an hour of your day. Treatment for this, again, CBT and specifically exposure and response prevention CBT. So this means like, let's say someone has an OCD symptom of having to unlock and lock their doors 20 times, otherwise something bad will happen. So you don't let them lock the doors 20 times and unlock them, and then they can see that nothing bad is going to happen. You can also treat OCD with TCAs and clomipramine. Imipramine is used for bedwetting issues in kids. Clomipramine is for OCD. Last resort, you can do a cingulotamine. So also it's important to remember that OCD is ego dystonic, meaning the patients know that their thoughts are irrational and their actions are irrational. OCPD is ego systonic, meaning they don't think anything's wrong with what they're doing. They are usually described as perfectionists. They like having things done their way and only their way. They can't see it in some other person's perspective, and they don't think anything's wrong with the way they're thinking. Sometimes OCPD can be confused with narcissistic personality in questions, but to differentiate between those two, it's important to understand their motive. So narcissism is motivated by external factors, like what people think of them. They want people to think highly of them. They want that fame, that importance. Versus OCPD is internally motivated. They want things done a certain way because they like it that way and it makes them feel better. Body dysmorphic disorder. This is when a patient is preoccupied with one part of their body for at least an hour of the day. So they'll stare at themselves in the mirror and be worried about their hair or the way their nose looks, for example. Again, for this, you can do CBT or SSRI. So you might have noticed CBT and SSRI are the most common treatments for these type of disorders. When in doubt on the psych shelf or psych questions, SSRIs and CBT are the way to go. But remember, for adjustment disorder, you don't give them any medications. It's only psychotherapy for adjustment disorder. Adjustment disorder is also a diagnosis of exclusion, is the way I like to think about it. So like, for example, if you have 5 out of 9 SIGI caps, then they've met criteria for major depressive disorder. So the key is, if they meet the criteria for any other disorder, you go with that. If they don't meet a criteria for another disorder, then you're kind of just left with adjustment. For adjustment disorder though, symptoms have to start within 3 months of the stressor and go away within 6 months. And it has to cause impairment in their social and work life versus the normal stress response that we talked about that doesn't cause any impairment. Also, quick note with SSRIs, it can take 4 to 6 weeks to have effect. And then once they are fully effective, you want to keep the patient on for at least 6 months before titrating them off.